Imran, for inviting me. Can you hear me okay?
Yes, that's absolutely fine.
I'm going to share my screen now, and I'm going to hope that it's the right one. Okay, can you see that?
Yeah, that's fantastic.
Fabulous. Just bear with me one moment. So can you just see the slide?
Yes.
Yeah. Okay, that's great. All right. Good morning, everybody. Thanks for joining us. And as Imran said, I'm Brigit McWade, and I'm a lecturer in medical sociology at Lancaster Medical School, and I'm also part of the admissions team. So I'm the lead for widening participation at Lancaster. So you were just discussing that in the questions, and I can talk a little bit about that later if we have time. But the main gist of this presentation is about helping you to understand what it's like to study medicine at university, make some decisions about whether medicine's for you and where to apply, and a little bit about our degree structure and talking you through the interview process. Okay, so let's get started. Nope. Sorry, just having screen sharing issues. Okay, here we go. So the first thing to note is a degree in medicine isn't the same as other university degree courses. First of all, it's longer. It's 5 years instead of the usual 3 years. And it's training you to become a member of a profession. So you have to demonstrate that you have the skills and values appropriate to the medical profession throughout your studies, not just at the end of the degree. And that means there are higher expectations of medical students in terms of your values and behaviours than perhaps your peers who might be studying sociology or English literature or history or something like that. Another way in which it's different from other degree courses is its experiential learning. So whilst some of your learning will take place on a university campus in traditional education settings, or not so traditional now at the moment in the pandemic, you don't just stay in the classroom or the online classroom. You learn through practice or on placement in a variety of healthcare settings. So medicine is a collection of different types of knowledge, from biology, anatomy, philosophy, law, and it means the curriculum is very varied and includes a breadth of subjects, not just science. And in addition to these academic subjects, you are also trained in different practical and vocational skills, such as clinical skills, how to diagnose patients, and communication skills, how to actually talk to patients and colleagues, and so on and so forth. So the first thing, what doctors are taught is set by the General Medical Council, who are the national regulator for medical education. And this means that every degree in medicine has the same curriculum. So the content of what you're taught, wherever you study, will be equal to that at any other medical school. The difference between medical schools is the way in which they teach the curriculum. So it's really important when thinking about where to apply to that you consider what your preference is in terms of learning so that you can make the right choice for you. So there are 3 different types or ways in which the medical curriculum is taught at different medical schools. We have the traditional problem-based learning and integrated curricula. The traditional way of teaching medicine is only actually taught at 3 medical schools now, and those are Belfast, Cambridge, and Oxford. In this mode of teaching, you have 2 years on campus being taught mostly through lectures in subject matter, for example, microbiology, biochemistry, and so on. And then in years 3 to 5, you take what you learn onto clinical placement. So this suits people who like to be taught to listen to lectures, write good notes, get the knowledge under your belt before you try using that knowledge in practice. The PBL, the problem-based learning curriculum, or PBL as we call it, and that's what we offer at Lancaster Medical School, involves a more active style of learning. And I will give you a bit more detail about PBL when I talk about our course in a moment. But briefly, it involves self-directed learning in small groups, where you learn about systems of the body rather than distinct subjects. So in the first year, you begin by learning about the upper gastrointestinal tract, including its anatomy, physiology, embryology, and so on. And also, what's different about PBL is that you have much earlier clinical placements, which starts at the end of the first year. The third type of curriculum, integrated, actually just combines the above. So more lectures and small group teaching, but also earlier experience. So where can you study medicine? As you can see from this map, hopefully, there are lots of medical schools in the UK. And they offer lots of different types of courses. So you've got standard courses, graduate courses, and foundation courses. And then some offer a combination of those, or some only offer one or another. And since 2017, the General Medical Council said that we needed to increase the number of medical students. So existing medical schools are taking more students, and some new medical schools have opened. So here are some new medical schools, several in the northwest here, UCLan and Edge Hill. And that's really good news for you, because it means there are more places available for you to apply to. But it also makes it a bit more difficult, because you need to work out how to choose which ones are going to be your choices when you come to apply. So how do you choose a medical school? Well, one good way is personal recommendation. Do you know somebody who's studied at a particular medical school, and what was their experience? Or do you know someone who knows somebody? Try and tap into your networks, family, friends, or through school. You can also look at the reputation or status of medical schools, although so you could see student satisfaction scores or teaching standards, and universities often publish these. You also need to look at the entry requirements. Excuse me. As we were just discussing in the Q&A before this talk, you need to do your research. Which schools would you like to go to, and what are their subject requirements? How many points do you need at GCSE? Which A-levels subjects will they accept, and at what grade? And then what entrance exam do they take? Is it the UCAT or the BMAT? So there are two different entrance exams, and so at Lancaster we take BMAT, but at another school it could be UCAT. So if you're applying to 5 medical schools and all of them take BMAT, then you just need to do BMAT, but it's likely that you probably have to do both, because not all medical schools are the same in terms of their entrance requirements. So it's really important that you get as much information as you possibly can when you're preparing to apply. Look at the medical school's website, get the prospectus, and go to open days. Now, open days at our university are still happening, but they're happening online. So far I've talked about generally that the difference between medical schools is that they have different ways of teaching the same curriculum. So the choice is about choosing a degree that accommodates your learning style. So you need to look at all the different medical schools that you think you might want to go to. But how do you decide that? Well, there's another side to being at university. What suits your needs? Where do you want to go? Do you want to be close to home, so it's easy, quick to nip home? Obviously, all of this advice is shaped from a pre-COVID world, obviously, but think about your living and travel costs. Look at the accommodation they have. What extracurricular activities are there? What's the student union like? What clubs are there? What do you want out of your university experience as a whole? And what do you want out of your medical degree? So really, I can't emphasize enough that it's really important when you're making the decision about where to apply that you really choose the right places for you. your learning and for your experience of higher education. So just to give you some information about studying at Lancaster, we offer 2 degrees. So we offer the A100 MBCHB in medicine and surgery, which is your classic 5-year undergraduate degree with a problem-based learning curriculum, early clinical experience, and smallish student numbers. So around 129 every year. And we used to offer a foundation degree, but we've now turned that into a degree with a gateway year. So it's a 6-year degree. So that's only for people from a widening participation background, which means you will have met 2 criteria to become eligible for that. And it's for people who aren't going to necessarily get the grades that you need to get onto the main degree. So it's just an additional year to prepare you for the main degree. So you go through the same application process. You're just applying for a gateway, the degree with a gateway year. So let's get into a little bit of what you learn. So medical education's aim is to ensure that graduate doctors will practice in ways that centre patient needs and safety. All medical schools have a curriculum, as I've said already, set by the General Medical Council in their guidance called Outcomes for Graduates. And as you can see from this image, the medical graduate must have learned a whole host of different skills and knowledge, as well as being able to demonstrate certain professional values and behaviours. So outcomes 1, just in case you can't read this on your screen, is professional ethical responsibilities, legal responsibilities, patient safety and quality improvement, be able to deal with complexity and uncertainty, be able to safeguard vulnerable patients, and to be able to lead and work within teams. So fellowship as well. Your professional skills are being able to communicate and work with other people, to diagnose and medically manage illness or disability, to be able to safely prescribe medications and use information effectively and safely. And then you also need all this professional knowledge, which is important for thinking about what you're going to learn when you study medicine. So you'll learn about the health service, healthcare systems in all 4 countries. You'll learn biomedical scientific principles, psychological principles, social science principles, stuff around health promotion and illness prevention, and clinical research and scholarship. So you can see the breadth of subjects that involves there. And at Lancaster, we teach this through different curriculum themes. So we have 4 curriculum themes, all of which are essential to delivering good patient care. So we have medical sciences, which include anatomy, microbiology, embryology, histology, etiology, pharmacology, and more. We have population health, which is about health in a population, how to study that statistically, how to promote health and prevent illness. Population health is very prescient at the moment. So all the debates about vaccination and social distancing and thinking about the prevalence of corona in an incidence in the population, and also how it might affect certain groups more than others. That's all to do with, you would learn to have versant in that. You'd understand how to talk that stuff really well after studying medicine. And then we have health, culture, and society, which includes health psychology. So that's thinking about why people act the way they do with regards to their health. And the sociology of health, which explores the way in which society is organized and how that can impact people's health. So we might think about health inequalities there. And finally, you study professional practice, values, and ethics, which explores the professional, ethical, and legal responsibilities of a doctor. And all of that is covered in PBL. And then alongside that, you learn clinical skills and communication skills in other sessions. So, as I mentioned before, problem-based learning in medical education is a method of active learning stimulated by and focused around a clinical community or scientific problem. So at Lancaster, each term you join a PBL group of about 8 students and you work together, and there's a tutor present who facilitates those sessions. A week in the life of a first year medical student means that you would do 11 2-week PBL modules, and your timetable would look like this. So you can see that you have 3 PBL sessions per module, 1 in the first week, and then 2 in the second week on a Monday and a Friday. In the first session, you come together and read the module's scenario, which is a story, a clinically realistic story about a patient and the doctors and other healthcare professionals they meet. And in each scenario, there are triggers to learning objectives in it. So you read the scenario out loud together and then discuss it. You highlight the key words and phrases that you think might form a learning objective. Think about what you already know about those topics, and then set your own learning objectives as a team. The tutor's there to facilitate this session, but students lead all aspects of their learning. The tutor's there to ask questions and keep you on the right track. So once you set your learning objectives, then you work independently to meet those learning objectives. And your learning is supported by recommended resources for each module, lectures and workshops. So we don't expect you to do it all yourself. So the key point here is that whilst PBL is active and independent learning, it is also very well supported. So if we come back to the timetable again, we can see that you have lots of time for self-study, lectures, and then you also have clinical and communication skills workshops, and even time and anatomy workshops, and then even time for sports or other interests if you're not sporty. Doesn't have to be sports. We don't force sports on anybody. Okay. So then coming back for the second week, you have 2 feedback sessions, and here members of the group reinforce their learning for each objective through discussion. So here are some of our students at the whiteboard. This is pre-COVID, so they are way too close to each other for now, but it might mean drawing diagrams on the board or just sitting and discussing what you've learned over the module. The feedback sessions help you check what you've learned and what you still have to learn. So you can teach other group members, and that helps to reinforce your learning. And the tutor can check that you've adequately met the learning objectives and ask questions to develop your knowledge further. Problem-based learning develops good problem solving, as the name suggests, teamwork, communication, and study skills. As healthcare professionals, you'll have to regularly solve problems by working and communicating effectively within multidisciplinary teams. And so PBL is really designed to support that and set in a habit of self-directed learning, which is something that you have to commit to as a member of the medical profession. It makes you a lifelong learner. If we look at the timetable again, we can see that alongside the PBL self-study and lecture, you have sessions in anatomy, clinical skills, and communication skills. I'm just going to talk a little bit about what those involve now. So at Lancaster, our anatomy involves teaching about both the macro and micro aspects of anatomy. We don't do dissection to teach anatomy at Lancaster. We use models. our own and each other's bodies, to examine and learn different parts, tissues and bones and so on. And you also get to observe a post-mortem examination. All of our teaching is clinically focused, mapping onto the problem-based learning modules. And we also make use of digital technologies as well. And if you go to our website, you can find a video that gives you an insight to anatomy teaching. But if we see here the main picture with the big screen with some bones on it, that's the anatomage, which is like a massive tablet with layers, all the layers of the body in it, so you can zoom in and have a look at, layers of skin, bone, tissue with great detail. And so this is a lot less messy and wasteful than dissection, and the opportunities for learning are much improved. So that's why we don't do dissection at Lancaster. In your communication skills training, we teach that through practice. So first of all, with peers, so with other students, you do role play and discussion, and then you work with simulated patients who are actors. And then when you're on placement, you get to start to practice your skills on real patients. So we don't just throw you in the deep end, even though you have early clinical experience. You get to develop the skills first and then develop them further in practice. And we use things like videoing your performance so you can look at what you could do better, and you also learn how to give constructive and receive constructive feedback around your communication skills, which is itself a communication skill, so everyone's a winner. Your clinical skills, first of all, you get taught on models, clinical models. So here's a student practicing injection on a model arm. Then you get to practice on each other. So here's two of our students practicing taking pulse there. And again, then you're out on placement and you're practicing your skills there. So again, there's always a safe place to start, make some mistakes, and learn from in our clinical skills labs before going out on placement. As I said, we do have early clinical placement, which begins at the end of your first year and increases each year until from year 3, you're learning entirely on placement. So this gives you a gradual induction into becoming a doctor with lots of practical experiences and clinical supervision. And at Lancaster we have, so this is another thing when you're researching your medical schools, is where are their clinical placements? So for some universities, they are partnered with one hospital. They're usually ones in big cities. They've got a big city hospital, and that's where all the placements happen. In Lancaster, because we're in kind of semi-rural location, we have placements in a variety of different hospitals and community health centres. So they are Furness General Hospital in Barrow-in-Furness, Royal Lancaster Infirmary in Lancaster, Blackpool Victoria Hospital in Blackpool, and Royal Blackburn Hospital in Blackburn, as that would suggest. But we also have some placements at Westmoreland Hospital in Kendal and community placements in Lancashire and South Cumbria. So the benefit of having so many different placements is that you gain experience in different clinical environments and get to meet a real wide range of different teams. And our students also say that these hospitals aren't as busy as big urban hospitals, and that means you get more time with the clinicians. Your community placements are in mental health, general practice, and sexual health. So think about, these are the kind of questions you want to ask yourself when you're deciding where to study, like where are the placements? So there's travel involved here, but we do have travel bursaries and sometimes accommodation is paid for as well. So if you're thinking about the costs or the time travelled there. Okay, so if you wanted to know more about Lancaster, studying at Lancaster, we've had some online open days, and we have another one scheduled on the 17th of October. So you should go to Lancaster University's main website and search for open days there and sign up. It's really important to go to open days and ask as many questions as you possibly can so that you're really making an informed decision. Okay, I'm just going to take one small sip of a drink. And talk about 2021 entry now and also interviews. So our selection process involves, first of all, looking for academic excellence and your achieved and predicted grades. And I can tell you what those are, but you could also look into that because this isn't all about Lancaster today. Then we want to see your medical admissions test score. So the first point is we look at your grades to see if you meet the grades. And then if you meet the grades, we'll look at your BMAT result. And then if that's good enough, these are good enough, we'll invite you to interview. We'll look at your personal statement and verify that the work experience you've had is the work experience that you've had and things like that. And then you will have to prove fitness to practice. So the first 2 bullet points there are our academic criteria. In the interview and in the personal statement, we're assessing you for your non-academic criteria. What are we looking for? Well, as I've explained, medicine isn't just about being good at science or being passionate about biology. We're looking for well-rounded individuals who are thoughtful, caring, and compassionate. And that's really important because that's what a good doctor is. We want to see that you have the capacity to become a good doctor, and that you're insightful about your own strengths and weaknesses, and are able to identify where your strengths are, but where you might need to improve. That you have the core values that are required for becoming a doctor. That you're motivated and conscientious. This degree is 5 years long. The timetable is very busy. It's a hard degree, and you need to be both. You don't just need to be academically able. You need to be motivated, conscientious, and also resilient to be able to face the challenges. So it's very lofty ideal to want to become a doctor, but can you actually do it? And that's why we have such a thorough admissions process, because we're trying to assess whether you can do it academically, but also can you do it personally? So I'm not going to talk about the academic criteria just now. I'm going to talk about the selection process in terms of interview. Medical school interviews do a number of things. They're designed to discover if you are suited to the particular medical degree program to which you have applied. So to meet that requirement, as I've said time and again already, you're getting bored of me saying this, you need to do your homework for every interview you attend. Each medical school, what is the course structure, and why does that course structure suit you and the way that you learn? Why is it the right medical degree for you? Secondly, interviews are designed to test if medicine is the right career for you. So more broadly, why have you chosen medicine? What do you know about being a doctor? And how can you demonstrate that you have the personal skills, values, and attitudes needed to be a good doctor? Now, here's a top tip. It is really highly recommended that you research the NHS core values. You're going to be trained in the NHS, and many of you will go on to work there. So it's really important to have an understanding of its core values and be able to demonstrate that you have the required skills to uphold those core values. This is where you bring in your work experience, your lived experience, to give examples of when and how you've demonstrated them. So don't just tell us that you know them and you agree with them. Show us that you do through concrete examples of your behaviour and experiences to date. We're looking for you to be able to communicate that with a wide range of people as well. So can you explain that to anybody that might interview you? So medical schools either interview by traditional means or through multiple mini interviews. Traditional interviews, which again are only at 3 medical schools, use this way of interviewing now. It involves a panel of experts, and you go and sit in front of them and they ask you questions and they all listen to your answer. By far, the most common way of interviewing for medicine now is multiple mini interviews, and that's what we do at Lancaster. So multiple mini interviews involve several different stations. So they could be in separate rooms or they could be on separate tables in the same room, depends on the medical school and how they organise it. Or as we did some of our interviews virtually this year, you went into a virtual room with an interviewer and then moved on to the next one. So in each station, applicants are asked to perform a range of different tasks, each designed to assess different skills, values, and attributes. You might also have break stations and preparatory stations. Each station has a clearly defined criteria against which we are assessing you. So each station is assessing something different, and each station has a different person assessing you independently of the other assessors. So this is where the real key difference is between traditional interviews and MMIs. In traditional interviews, everybody hears your answer to every question. In MMIs, if you don't do very well on one station or one question, it won't influence the outcome of the next one. So you have multiple independent opportunities to do well. And also the interviewers don't get to influence each other in terms of their perspective on how well you did. So you're independently assessed. Some examples of MMI stations. So they might be interviewed based. So we might do a short interview with you to probe your understanding of your career choice. Why medicine? Why you? They might be task-based, so you might get to do a role play with an actor, and that might be to assess your communication or problem-solving skills. Or you might even interact with a member of the public. We do have patient interviewers, and we also have clinicians, and we have academics. So there's a wide range of people interviewing you. You might have a short group work exercise. So read and analyse a PBL scenario together to see how well suited you are to problem-based learning and to see if it's suited to you as well. And you might have a preparatory station where you read or watch something in advance, and then on the next station you discuss it with an interviewer. Okay. So that's what's involved in multiple mini interviews. Some top tips for preparing for that. Arrange a mock interview, at least one. Don't do it with somebody who knows you too well. You want to have a realistic kind of test run to be able to explain yourself clearly to someone who doesn't know you. Don't rehearse pre-prepared answers. You don't know what you're going to get asked, and it will stop the conversation from flowing. And you should really be able to, you should know yourself and be able to demonstrate your skills without rehearsing it, because rehearsing it's kind of fake. So you need to develop some kind of trust in yourself that you are the right candidate for this degree, and you can show that through these stations. So most common types of questions are either behavioural or situational. So, what have you done? Or what would you do? So either referring to what you've already done, or being given a problem and working out what you would do in face of that and why. You have to be expected to be challenged. So this relates back to that rehearsing pre-prepared answers. Is if then somebody says, "But what about this?" and you've not thought about it, it's going to leave you in a bad situation. Whereas if you're approach it more like a conversation or a discussion, then you don't think that they are thinking this person's an idiot because they've asked you a question. They're just trying to get the best answers out of you. So be aware that we're not trying to trip you up. We're trying to facilitate you an opportunity for you to show yourself in the best light possible. A lot of time should be taken on reflecting on your work and voluntary experiences and being able to bring these in as examples. So again, concrete examples, not just telling us that you subscribe to the NHS core values, but how has something you've done shown that that is the case? And another top tip is to keep up to date with topics of medical and ethical issues in the news. Radio 4 has quite a lot of programs on medical ethics, but also because we're living through a pandemic, there's just so much out there at the moment. So really thinking through the ethical challenges of medicine at the moment would be a top tip. I also want to really, really emphasize that the Medical Schools Council website is your go-to repository of all the things you need to know for deciding, applying, and getting into a medical degree. They have information about all the different types of medical education, what it's like to work as a doctor, how to apply to medical school, how to prepare for medical school, and much, much more. I would just bookmark this webpage, which is www.medschools.ac.uk/studying-medicine/. It's just a wealth of information, and it's all free as well. It's all you need. And then secondly, I would say when you've started to identify the courses that you think are right for you, get in touch. Find out when their open days are, and maybe use things like Unibody to talk to current students to get a sense of what it's like for you, for them, and whether it's the right place for you. So research, and the more you know, the better equipped you will be to succeed in your application. Okay, any questions?
Dr. McWade, thanks for that very useful talk. Yes, some of our students have got a few questions. First of all, what's your view on the grades that have been given during the pandemic? Obviously, there's a lot of anxiety, over predicted grades and actual grades, and how the universities will view them. I think this may be of concern of students that perhaps have just done their GCSEs and felt that they haven't performed as well as they would have liked to. What will be the university's view, do you think, going forward in a year or two's time on students that are going to be using grades from this academic year?
I'm afraid that I unfortunately cannot predict what the university will do, and it was good to note that it's not these decisions aren't made independently by universities. UCAS and other national bodies involved in the governance of exams also play a role, and as we saw over the summer, they don't always necessarily come to the right decision. And then I guess it's important to note that this is new for everybody. And so it's very hard to predict what will happen in a few years' time. However, we are all living through this, so we all know that it's having an impact on you all. So you should be reassured that admissions teams are not going to penalise people for having lived through unprecedented times, but it's very hard for me to give you any clarification about how we'll deal with that. However, I think, again, the best thing to do is, if you have questions relating to specific admissions policies, is to contact each of the schools that you're thinking of applying to and asking those questions. And we will also, when decisions are made, publish them on our admissions pages. So it won't be kept secret from you either. But I totally recognise the dire straits young people are in at the moment in terms of the impact on your education, and that's the long-term effects of this. So we've seen what's happened with this year's intake is that they calculated the grades, they went back on the grades and changed them, and that has meant that we have taken in each university has taken in many more students than we would normally, because places to study medicine are usually capped. So we've taken more people in, but also some people have decided to resit their A-levels in autumn, so that's going to have a knock-on effect for people applying for next academic year, because there's probably going to be more people coming in. So it's very complicated, and I understand that people want firm answers, but actually I think we might have to get used to the idea that we are quite often going to have to wait for national decisions in order to make local decisions in terms of how we can best support your journey into higher education.
Yeah, that's good. Thank you for that. I've got a question here we've actually got a lot of questions about foundation year, the 6-year foundation year program. Yeah. What is that? A lot of students are asking about what the entry requirements for that, and what's the application process for that particular pathway.
So okay, so you need to meet our widening participation criteria for the foundation year. So if you're predicted AAB or above, you can apply for the standard degree, the 5-year degree, and if you meet our criteria, you'll be offered a widening participation offer would be ABB for your A-levels. If you're predicted BBB to ABB, you can apply for A104, and the standard offer for that is ABB. It could be confirmed on lower grades, but do not bank on it, because we do need to see that you are of an academic ability. So our widening participation criteria can be found on our website, but it includes if you come from a low income household, whether your school, what your school is. So if it's a state school or a public school, so we look for non-selective state schools. So schools that are free to attend and you didn't have to take an entrance exam to get into. And we look at each school's Attainment 8 score, which gives us an idea of how well overall that school is doing in terms of GCSEs and A-levels. It might be that you're the first in your family to attend university, so that's another criteria. So if your parents didn't go to university, or they only went when they were mature students, so over the age of 21, that also is a criteria. If you're a refugee, a local authority care leaver, or a young carer. So those are some of our widening participation criteria. You can see the full list. So also, for low-income household, we might see that you're in receipt of free school meals, or your family is in receipt of some income assessed benefits. So those are the ways that you would prove that. So you do have to fill out a form, and you do have to provide evidence that you do meet those criteria. And some people meet many more of those criteria than 2, and some people meet 2 in that. And so what we do is we adjust for that context. So we give lower grades for entry. And so the gateway year is designed for students who are not eligible to directly apply for the medicine degree programme, and that fulfill widening participation criteria. So whilst you can get a contextually lowered offer for our main degree if you're WP, the gateway year is only for people from widening participation background. Is that okay?
Yes.
Did you want to know about our A-levels? Or was that part of the question as well?
Well, just the entry. They wanted to know the entry requirements for the foundation year.
Okay. So just as note on the A-level subject, so I know we had that discussion in the Q&A before, we want 2 of biology, chemistry, or psychology. And the change around chemistry is because there aren't enough chemistry teachers or chemistry A-levels being offered everywhere. So it was disadvantaging people. So if you can do biology and psychology and a third A-level in any other subject, that's fine. Or chemistry and psychology, or biology and chemistry, those are the options. And if you do an EPQ, we want to see it at B or above.
Yeah, that's great. Yeah, thanks for that useful information. We've got some questions about transferring from other professions. So I think we've got a nurse that wishes to go from nursing into medicine. Is that available at Lancaster?
Yes, we have people who study who are already graduates. So we'd be looking at your degree qualification as part of the entry. Yes, so all the information about admissions is available on our website. But yes, that is something that's available at Lancaster. I don't think you can't transfer from the degree. You would have to have completed the degree, but I'm not certain on that. So I would ask, if you've got specific questions relating to your own specific circumstances, that you email medicine@lancaster.ac.uk for specific questions.
We've got some questions from international students. There's one student that's mentioned that I assume she's doing a medical degree already in Europe and wishes to transfer halfway through the degree from a European medical school. Is there any views on that, or?
I don't think we do that, but again, these kind of specific questions are best directed to our admissions team. I'm new in post, and I've mostly been focusing on widening participation. So the rest of our admissions team have a much finer, granular understanding of our admissions criteria. So for specific questions like that, medicine@lancaster.ac.uk, but also check our website. And I would say that would be the same for any medical school. We love to hear from prospective applicants. Don't feel like you can't contact us to ask us, well, this is this is maybe an odd case, but I'm in Europe studying medicine and I want to come to the UK to do that. Can I do that at your medical school? It'll be easy for us to answer that.
There's a question here about, an interesting question, it's asked every year. I've got a parent who's in the medical field. If I put that on my UCAS statement, is that looked down upon?
No, not at all. Why would they think that would be a bad thing? That's good. That's great. You've got great insight to what it means to be a doctor. So, you can put that in. Don't just say, mum's a doctor, because that's not interesting. Always, when you come to your personal statement or interview, why is that piece of information relevant to you studying medicine? So I know mum's a doctor and I've learned, the challenges of the working hours and, that kind of thing. If you're just going to mention it because you think it's going to get you in, it's not going to get you in. We're past those days, but you must always reflect on why you're telling us something. So don't just say, I did some work experience in a care home. Give us an example of how that gave you an insight into the caring profession, how you saw how the team worked together, those kind of things. So how does it give you an insight into being a doctor, and how does that relate to your experiences and what you can tell us about you and how you demonstrate the core values that you need to become a doctor? So yeah, I guess my key point with personal statements and interviews is, why are you telling us that? What does it demonstrate?
Okay. All right. So, Dr. Mannon, is there any further questions from Facebook or?
Yeah, there is a common thread developing here, Brigit, and this is around EPQs and the DOE qualifications and so forth. So it kind of alludes to some of the comments you made earlier on about mentioning of one's parents in the profession, I suppose, in that does EPQ add value to that application? Does involvement in the Duke of Edinburgh Award and things like that, does it help towards the cause? So if you could perhaps elaborate on that.
So it's not an expectation that you do an EPQ. And if you do an EPQ, you need to do well in it. So you might want to think about whether you want to focus purely on getting those A grades at A level and put all your time into those studies, or whether you think an EPQ will be valuable to you. So also, what's the subject matter of your EPQ? If you do something related to health, how can you make that work in your personal statement? So I did an EPQ on something, I can't think of an example now, but I do know somebody had used their example in their personal statement of the EPQ to demonstrate motivation and interest around a particular area of health. So, the value of learning for personal enrichment, so that you become a more well-rounded individual, is definitely beneficial. But so it's decisions about priorities here, I think, and then other extracurricular activities. Excellent. Anything that you do, I would try and link to how it demonstrates the values, attitudes, and behaviours that are relevant to medicine. So I can't give a yes or no on anything. I can just ask you to question your decisions and consider your decisions in terms of what's going to add value to you as a person, in that you are then able to take forward in your personal statement and interview to demonstrate that you meet those core values, attitudes and behaviours that are relevant studying medicine. So when we screen, we look at we look at your academics first. We look at what you got GCSE and A level. Anything additional is kind of, you have to meet the B in the EPQ at least. But other people will be applying without an EPQ and they won't be disadvantaged because of that. So then it's how you use that EPQ or that Duke of Edinburgh award in your personal statement and interview that's going to be most important. I think at root it demonstrates a commitment to lifelong learning and an interest, So it's going to be of benefit, but if it takes away your time from scoring your A's at A level, then that's not a good thing. I hope that's clear.
Thank you very much.
Yeah, Dr. McWade, there's a question here. We've never had this before. There's a question here about home-educated students.
Right.
Now it sounds as though this particular student has only got 5 GCSEs or is preparing for 5 GCSEs. What are the university's views going to be on that?
Well, GCSE grades are GCSE grades, as I understand it, but we would need 8 GCSEs in at least 8 subjects at grades 6 to 9, and they must include science, either core and additional, or biology, chemistry and physics separately, English language and maths. So you need to have those. That's non-negotiable.
Okay. Yeah, that's. I think that was our impression. That you've got to meet the minimum entry requirements unless perhaps you fit the widening participation criteria.
That regardless of WP criteria, you still need to have the GCSEs. Because as I say, the widening participation criteria is for recognising that your context in which you were educated and grow up might be different to people with extreme privilege, but we still expect academic excellence. So as you can see, the adjustments are fairly minor and they're at the A-level stage, so you still need to have got your GCSEs in place.
Okay. Is there any further questions, Abdul, from your side?
There's a few coming through as we speak. There's something about MMIs.
Mm-hmm.
What's the best way to prepare for them? You perhaps some of us missed that part of your discussion that Brigit, you mentioned earlier on about preparing for MMI. Refer to the LMS website. If you could perhaps just pick on one or two things regarding preparing for MMI, perhaps.
I think so. My key take-home point is make sure you know why you want to study medicine, why you want to study medicine at that particular medical school. So do your research. Why are you particularly suited to the way that they teach medicine? And so know what you're applying for and know why you're suited to it. Preparing for interview is you should try and arrange a mock interview with somebody who doesn't know you very well. Don't rehearse pre-prepared answers because it sounds very staid, and you're going to get asked a lot of different questions on these different stations, and they're going to be different types of questions and different types of assessments. So it's really hard if you just go around repeating the same thing, it's going to seem fairly robotic and not very authentic. So we're really trying to get to understand why you and why come to this medical school and how do you demonstrate the NHS core values. So look at them, know them, and be able to relate your work experience or voluntary experience or lived experience or studies to those core values. So always back it up with ways in which you can demonstrate that. Immerse yourself in medicine, in the news, media, and expect to be challenged and take part in a conversation rather than just be asked a question and give an answer. So prepare for it to be interactive, and on the day, try to relax and enjoy it. And remember that each station is independent. So if you really make a mess of one and think, oh dear, I'm never going to get in, don't give up, because the next station is a fresh opportunity to show yourself in the best light. So yeah, just do your research and be really sure that that's the right place for you, and that you really are suited to medicine and you know why.
Great, thank you very much.
Okay, there's a question here. It's interesting here. We've got a student who's actually fits the widening participation criteria, but is actually studying at an independent school because she gained a scholarship. I know some of them have their own widening participation kind of criteria, don't they? Would there be any barriers to that student applying for under the widening participation criteria at university?
As long as she meets two criteria, we don't subtract. So we don't say, oh, you meet two, but this one's a selective school, so we're going to take away one of your criteria. So, so as long as you meet two, that's fine.
Okay. Is there any further questions, Abdul, from your side?
No, the Facebook stream. There's other things related to, say, BMAT, and I know there's a session on BMAT later on. I know Lancaster does use BMAT.
Yes.
Can you want to comment on at all, Brigit?
Yes, we use BMAT, and we have offered some training on BMAT. Is there any specific questions that they're asking about BMAT that I can try and answer?
It was about what is BMAT and so forth. So there is a whole section on this afternoon.
Okay.
I don't want to be repeating things in the conference, but
sure.
Maybe perhaps what from a Lancaster point of view, what you want from the BMAT, and maybe scores or anything like that.
I don't have the scores to hand. Oh, right. Yes, I do have the scores to hand. Sorry. So for our main degree, we are usually, the average score is of those invited to interview is 11.7. So that's, not very helpful, because it can be lower than that, but I'm saying not, so that's average, so it's not the exact score. You must aim for 11.7. I'm just saying, looking at our data from previous years, the average of those invited to interview is 11.7. Those that get offered a place are usually around 11.8, and all of our students' average score is 11.5. So it's kind of around that area. But I should just say that there's lots of free resources available on the BMAT website to practice papers, videos on how to prepare, resources and all of that. So again, research, the information is out there for you, and it's out there for you for free as well. So you don't need to pay to go on BMAT preparation courses. And my colleague who does the training for the BMAT says there are 3 myths. One, that you need to be studying A-level maths and physics. No, you don't. Section 2 is based on GCSE science and maths, but the style of question is different. The other myth is that BMAT is super difficult. Actually, if you're good at science, you'll probably be good at BMAT. And thirdly, you need to pay for an expensive preparation course. No, everything is there for free on the BMAT website. So you would sit BMAT you'd register from between now and the beginning of October for this year's intake. There's a late registration before the 15th of October, and the test would be on the 4th of November, and the results would be by the end of November. So we get the results after we've reviewed all of our applications, and applications have closed, and we use it as the secondary criteria to assess whether we're going to invite you for interview or not. So it's another test of your academic ability, but you also have a writing task to communicate, show your communication skills. So,
brilliant.
okay.
Thank you. Wonderful. That's it from me, Imran.
Yeah. Okay. So yeah, I don't think there's any further questions. So I think what I'd like to do is thank Dr. McWade for taking time out of the weekend for coming and speaking to us. Yeah, it was an absolutely fantastic talk. I think we will agree that there's a lot to be gained from what Dr. McWade has told us. We've gained a lot of insight about what it's like studying at Lancaster, and some tips about the MMI interview process. So again, I would say Lancaster is a fantastic medical school. We've had students from Lancaster, in our practice here in Haslingden in the past. And once again, thanks, Dr. McWade, for giving your time up and giving that excellent presentation for us.
Thank you for inviting me. And as I say, if anybody has specific questions, you can email our team at medicine@lancaster.ac.uk. Thank you so much for inviting me. Have a good rest of the day, everybody. Bye.
Ta-da. Bye-bye.